Welcome back. A third wave of COVID-19 cases is now sweeping across much of Europe, and now health experts in the U.S. are concerned. Here to talk about any lessons that we can learn and how numbers are looking here in the States, we bring in our 9 health expert, Dr. Payal Kohli. Good morning, Dr. Kohli. Nice to see you.
Good morning, Natasha. Great to see you too.
So what are health experts saying about this uptick in Europe?
The uptick in Europe really does help us here in the United States to know what landmines to avoid, because Europe generally tends to be about 3 to 4 weeks ahead of us. So if you think about what led to this uptick, it was the perfect storm of factors. So they had a pretty high baseline of cases when they decided to open up many of the countries. On top of that, these new variants, specifically the B117 variant, that's the variant that originates from the UK, has quickly become dominant in Europe, and their vaccine rollout has been incredibly sluggish. So really all the perfect factors for the virus to get an advantage that have led to this third wave.
You know, back here in the States, how are our numbers doing for our case numbers? Do we have cause for concern looking at what's going on in Europe?
I'm starting to get concerned, I have to be honest, just because we are headed along the same trajectory as Europe. So we're doing much better than we were doing earlier this year, but we're still in a really bad place. So if you look at our numbers, we have 50,000 or so new cases every day here in the United States. So it's a very high level of baseline. And then, as you just mentioned, states like Texas and Mississippi and others are lifting mask mandates during this critical vulnerable period. Now, we're doing much better than Europe in terms of the vaccine rollout, but still only a minority of Americans have even received 1 dose of the vaccine. So we have to keep all that in mind with the B117 variant starting to become more dominant here in the United States as well.
You know, I want to pivot a bit and talk about COVID-19 vaccinations and how people are reacting to that, specifically people who have had COVID before and now have long-haul symptoms. What has been their reaction to the vaccine?
This is incredibly interesting because there was some worry initially in these patients that their chronic symptoms could get worse with the vaccine, but we've actually seen the opposite. So many of these patients have been suffering for months and months, and they're finally getting relief when they get 1 single dose of the vaccine, which seems to improve and sometimes even resolve their symptoms. Now, we're not entirely clear what the mechanism of this is, but there's a couple of theories. The first is that there's remnant viral particles that are persisting in these people that are causing these long-haul symptoms, and then when you give the vaccine, it activates that immune system to clear that remnant virus so that their symptoms get better. The second is that there's autoimmune cells that get activated after the COVID infection, so cells that attack your own body, and then when you give the vaccine, you basically distract the immune system so that those autoimmune cells are not attacking your body anymore and sort of get turned off.
That is very encouraging news. I also wanted to ask you about any new information that we may have learned about reinfection in those who have already had COVID-19.
Yes, another great question. A new paper came out just this week in The Lancet that tells us about reinfection and who's most vulnerable. Also gives us a little insight into antibody protection. So we're thinking about the 6 months after natural infection, you're relatively protected from reinfection. But when we do look at those that get reinfected, even though it's rare, it tends to be those older than 65. In fact, if you're older than 65, you only have a 47% protection as opposed to an 80% protection for those that are younger. So really a warning sign specifically to our older population that has had COVID and recovered to definitely go and get that vaccine because they're the most prone to reinfection.
All right, Dr. Kohli, nice to touch base with you, see how things are going with COVID. Nice to see you. Thanks so much.